Tell me what to expect regarding cervical mucus during ovulation.
Are you trying to make a little bundle of joy that leaks from both ends?
There is people who track cervical mucus and avoid sex during those times.
Sperm can live for several days in the body, so you could get pregnant if you had sex several days before the cervical mucus changes, signaling ovulation to a couple days after.
So what does cervical mucus do during ovulation?
Cervical mucus is normally white, thick, gooey and clumpy.
I thought it changed when you ovulate.
Yes, it becomes clear or light white, watery, less sticky. That's to let the sperm in.
I guess that's part of its job.
The cervix itself changes too. When you ovulate, it is usually lower than normal.
I know that it closes and shifts during pregnancy to accommodate the growing baby. When you are in labor, it dilates to make room for the kid's head.
Before and after ovulation, it feels like a nose tip. When you are ovulating, it becomes softer.
I guess that's preparation for trying to get pregnant.
Your body changes every month or so in an effort or preparation for trying to make more littles. The cervical mucus changes are only part of that.
What else should I look out for?
Aside from a positive ovulation test,
Those are expensive.
some women feel a pain in the side of the abdomen when the ovary follicle bursts to release the egg.
I'm glad I do not have that problem. PMS is bad enough.
Only 1 in 5 women have the symptom, and a lot of them have it so mild that it can be mistaken for a strained muscle or muscle twinge.
So I might have it but not realize what it is.
Some women experience changes in their breasts too.
I think that's a lot more obvious if I had conceived after ovulation.
And it would come with twinges and aches in your abdomen as the uterus expanded to make room for the kid.
I just want to know what changes signal that my body is ready to make a kid at this point.
Then track your cervical mucus for becoming clear, watery and less yucky. And if you track your body basal temperature, that will go up.
First, it only goes up 1 degree at most. Second, it only goes up the day after I ovulate, which is probably too late if I'm tracking that to determine fertility.
There's always the fallback of having sex every night if you want to get pregnant.
I cannot imagine any guy for whom that isn't the first plan of action.